Chapter 7, Treatment of Anxiety Disorders. This chapter explores the symptoms associated with anxiety, the general concept of anxiety, and its role in behavior. A biological explanation for panic states is explored along with various treatment options and cautions. Anxiety is the second most common disorder presented in mental health and medical settings. It is linked to abnormal regulations of serotonin, GABA, and glutamate. Substances or drugs may also exacerbate anxiety. So take into consideration if a person is taking amphetamines, diet medication, asthma medication, caffeine, even nasal decongestants. This could exacerbate or even may cause the anxiety. Symptoms of anxiety are nervousness, worry, agitation, insomnia, rapid heartbeat, etc. There are different categories of anxiety disorders, including generalized anxiety disorder, social phobia, panic disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. The majority of anxiety disorders respond well to psychotherapy and relaxation techniques, cognitive therapy, cognitive behavior therapy, and sometimes a combination of medications is the best prognosis for resistance to relapse of symptoms. Panic disorder with or without agoraphobia. There are 3 stages to the treatment of panic disorder. The first stage is to stop the panic and is usually used with benzodiazepines. During the first stage, the therapist might see that the client is experiencing intense anxiety and needs immediate relief. Sometimes the client might have found that alcohol has been their vice to reduce their panic. However, we know that might lead to a substance dependency. So when we look at medication, a primary care physician will often prescribe benzodiazepines to the client with panic disorders. However, they may forget to follow up. This is where the second stage comes in regulating the limbic system with an antidepressant such as an SSRI or MAOI. Once the panic has been controlled by the benzodiazepines, the use of various antidepressants increase the serotonin and help regulate the limbic system. MAOIs work as well. However, due to the dietary restriction, there's a poor compliance results because of those restrictions. The next stage is to provide appropriate psychotherapy to educate the client and reduce anticipatory anxiety of self-defeating behaviors. And this is where cognitive behavior therapy would be effective. In some cases, the anticipatory anxiety of the panic attack is more debilitating to the client than the panic itself. With this disorder, it's very important for the therapist to address all the stages. It is also important to slowly withdraw the benzodiazepines, and it might take 2 to 3 weeks before the patient might be taken off of the medication. To abruptly take them off could lead to another panic attack. Psychotherapy might be attempted at any point during this process once the patient is calm enough to focus and concentrate on the session. Generalized anxiety disorder. Some researchers believe that generalized anxiety disorder is closely related to depression than it is to anxiety. Cognitive therapy is helpful as a form of psychoeducation, which allows the client to see patterns of their perception of issues and the behaviors or actions that follow. Although benzodiazepines have been used to treat individuals with generalized anxiety, it is not the best approach because it does not teach the client how to manage their condition. Antidepressants such as Effexor, non-benzodiazepines such as buspirone, and most SSRIs such as Prozac are used to treat generalized anxiety disorder. Sleep aids are often used because the client may have racing thoughts. The client may end up getting a prescription or an over-the-counter. Even an over-the-counter such as Benadryl has been useful in treating individuals with generalized anxiety disorders who have racing thoughts and have difficulty sleeping. Atypical antipsychotics have been used adjunctively with SSRIs to boost the effectiveness of the SSRIs, which have been shown to be effective in reducing the racing thoughts that a generalized anxiety disorder client may have at bedtime. Post-traumatic stress disorder. Previous treatments such as benzodiazepines and neuroleptics were quite often used to treat PTSD, especially when the client was demonstrating psychotic behaviors. However, success with SSRIs have been shown to be really effective with treating individuals with PTSD, as well as atypical neuroleptics. As a matter of fact, the current treatment for individuals with PTSD are SSRIs and atypical neuroleptics. Prazosin may be a promising medication when trauma-related nightmares and sleep disturbances are prominent symptoms in individuals with post-traumatic stress disorder. Psychotherapy is always beneficial, as well as behavior therapy. Therapy is a very important part of treatment for clients with PTSD. The clients may need to slowly expose themselves to the event or events that have contributed to their condition. Various behavioral therapies and imagery rescripting and rehearsal have been found to be also effective. Individuals with PTSD typically abuse substances in an attempt to dull the pain and anxiety. Detoxification may be needed prior to medication administration. Obsessive-compulsive disorder. Psychotherapy alone has not been shown to be very effective. Behavioral and cognitive behavioral treatment, along with medication, offers the best possibility for individuals with obsessive-compulsive disorder. And like with many other anxiety disorders, SSRIs have been proven to be effective. Tricyclics have been used, but the side effects have led to poor compliance with clients. A low dose of an atypical neuroleptic may reduce the racing thoughts and insomnia that individuals with OCD might have. Memantine, or the brand name Namenda, are used in children and teens who have severe treatment-resistant OCD. Social anxiety. It is very important to determine that the client has never had a history of panic disorder when we are dealing with clients who have social anxiety. The physician might prescribe a benzodiazepine. However, just like with other anxiety, SSRIs and MAOIs have been the overall best results. We might find that our clients might end up abusing alcohol in a social setting to end up relieving some of those anxious feelings. So that may need to be addressed in a therapy setting. In some studies, beta blockers and also alpha agonists have shown to be effective in the treatment of situational anxiety. From a therapeutic stance, behavioral-based treatments help the client to see the connection between environment and the fears they produce. Cognitive rehearsal and role-playing may assist the client to achieve a more lasting recovery. Treatment reminders and cautions. It is always important to let our clients know about their diet and modifying it. Once again, there are certain things that can exacerbate or cause anxious symptoms, such as stimulants, caffeine, our sugar intake, so on and so forth. Also, when we're talking about the treatment reminders, there are the 4 B's when it comes to the medications that are used to treat anxiety. We have the benzodiazepines, the barbiturates, the buspirone, and the beta blockers. With some of these medications, such as the benzodiazepines, Discontinuing the medication should be done gradually and under medical supervision, and only after the client has discussed other options with the therapist and the prescribed professional. When we look at side effects, some are usually mild and similar to those of antidepressants. So this may include drowsiness, dry mouth, nausea, headache, and dizziness. It is very important to discuss the side effects with the client.